Good afternoon, and thank you very much for being here, and thank you, Dipanjan, for inviting me. When anyone says the word Cisco or the name Cisco immediately conjures up images of connectivity equipment. We are in the business of connecting things, connecting people, connecting data and information. So anyone would think that a presentation by someone from Cisco is going to be a lot of technology. Mine will not touch on technology as such. The group that I head is a strategy consulting group, and I focus on healthcare and development because they are so completely integrated issues. So the brief I had was, you keep talking about connected health, and we do, but is it relevant to India? Is there not a lot of skepticism about does connected health really make sense in a country like India? Would that be our priorities, and so on? We did hear, that technology, we all believe passionately that technology is the solution to a lot of our issues. We also heard a certain amount of skepticism. How much do we want to go forward with technology? Do we not have more fundamental issues to deal with, and so on? So, given the fact that we are all convinced that technology is relevant, I'm going to try and focus more on how rather than whether. So, the slides were created assuming that we were going to be looking at is it relevant, but when I talk, I'll try and talk about how. So I'm going to start by just talking a little bit about connected health, putting it in context, because it means so many different things to so many different people. So I'm going to try and put that in context just for the sake of this discussion. And then I'll go through a few scenarios, and the basic premise of all of those is that connectivity, or the conclusion from all of those, is that connectivity and connectedness are completely important and basic to making any of those things work. And then spend a little bit of time on how the solutions can be introduced into India. So just by way of setting the context, we believe there are three very key trends taking place in healthcare. We are seeing the shift from cure to health, and again, we've heard hospital after hospital telling us that. We've heard presentations just before this that have again focused on prevention rather than cure alone. Care is shifting from the hospital environment to the home, and that is again something that we are seeing. Doctors, in the past, we used to go to a doctor and say, "Doctor, I have a headache," or "Doctor, I have a stomachache," and doctor would take a little sheet of paper, write down, "This is what you should do," and send me back home. I'd go home and faithfully follow whatever it was that the doctor said. Gone are those days. Now, if I see a test report, the first thing I do, get on my BlackBerry, check what that thing means to me. If the doctor says, "I have a problem," I'm going to get on to the internet or call a friend, find out what it is, what does it actually imply, what does it mean. So, and most of the time, patients are saying, "Allow me to take charge of my health. I want to participate in the way I'm being treated, in the actual treatment, and in staying healthy thereafter." You would have noticed that when in my title, I've actually called it "Just Keep Me Healthy." And that really is, I guess, reflects the mood that we all are in, where we say that for India, it's a lot more important that we focus on prevention and on staying healthy than on what happens if someone were to fall ill. So, when we look at healthcare, IT, or technology solutions being introduced into the healthcare systems in the West, we essentially see three waves in which solutions have been introduced. The first wave really focused on transaction efficiency. A lot of hospital systems that were focusing on how to improve the efficiency. The second focused on care delivery and how, again, care delivery could be made better, could be improved, could be made more efficient. And the third was really looking at, now that we've got all this done, how do we differentiate ourselves? How do we look at disruptive technologies? How do we bring them into our practices? How do we bring them into our system? But what we're seeing in India, though, is that we've decided that we're not going to follow this set pattern. And what we are seeing is bits from all of those three waves happening, coming in simultaneously into hospitals. So you will have concepts like for example, remote patient monitoring or telehealth being introduced at the same time as looking at basic transactional systems. So that's what is happening here. But bear in mind, and the only reason for putting this up here is not to say that we have to follow the sequential path, but rather to say that when we look at introducing these bits and pieces, that's perfectly okay, but just make sure that the other foundational pieces that are required for that are put in place either simultaneously or at a suitable point of time. So, to define the connected health framework as we see it is basically about using technology which will share information, vital information, that will allow a healthcare organization to improve safety, cost effectiveness, and the accessibility of care. So if we look at that as a fundamental definition of what we mean by connected health, then clearly there are a few tenets that become obvious. The first is that patient needs drive the way we put everything in. And again, we've heard that theme time and again. We've said, put the patient at the center. Then we look at being able to collaborate across boundaries. And when we talk about boundaries here, this is between hospitals, between hospital systems, between public, private. So it's a whole bunch of all of those systems, and it's being able to collaborate across them. Later on, we will also look at what the ecosystem really looks like, and it's very, very complicated. And then, of course, being able to share information and, more importantly, knowledge between the patient and the doctor. See, most of what we've done in the past has been based on the fact that the doctor knows better. But what we are getting to now as we look at patient empowerment is that the patient could also know and would know a lot about themselves, their family, their background, and what is happening to them as a result of their treatment. So there's a lot of information that the patient has, a lot of knowledge that the patient has, and there should be some way of being able to share that knowledge as well. Again, making healthcare more responsive, and finally, spending more time on caring rather than on a lot of administrative tasks. So with that background, I'm now going to look at, take you through 4 scenarios, what is happening at the hospital. And here we are seeing clearly the patient is no longer called a patient, is being called a customer. Yesterday I was very delighted to hear Sangeeta say that we're looking at CRM concepts in the hospital. So that is a substantial departure from the past. Again, hospitality and concepts from hospitality industry are being introduced into the hospital. Infotainment is interestingly taking center seat and is becoming a very important area that hospitals are focusing on. And then, of course, we talk about prevention, about taking charge of health, and there again, the whole issue of awareness and education of the patient's family, caregivers, all that comes in. And then the focus on what is the customer experience within the hospital. So this is the way the role of the hospital is changing. At the same time, there are several studies, and all of them point to the fact that clinicians actually spend a lot of time searching for information, searching for things, a blood pump or an X-ray or whatever it is, searching for other people, paging a doctor, for example. So it's a lot of time that is actually being spent on trying to locate something. And what we say is that the ability to track and be able to connect to either another person or an equipment or a thing or information wherever you need to be, wherever you are, and at the time whenever you need to. So that is really what we define as mobility. What enables that to happen, though, is the fact that medical devices are mobile. A whole bunch of pictures there that you can see, they are pervasive. So they are available wherever you need them to be, and they are connected. we believe in Cisco, we believe that we are moving to to a situation where we will see the Internet of Things. So the Internet earlier used to be something that you connected to from a laptop, from a computer. Now we are seeing that the Internet allows you to connect a whole lot of things to it too. So the reason why, though, it's not just the devices. You're able to achieve better levels of care, not because the devices alone are there, but because you're able to standardize the clinical pathways, the treatment pathways, the way you approach something, the processes, all of that, and because you're able to collaborate. So these two taken together, along with the device mobility, is what allows hospitals to look at and be able to provide much better, higher levels of care. So that would then allow, because we are doing all of this, it would allow us to reallocate the time that clinicians spend on administration, tracking, and so on, and be able to provide that time, give that time to the patient directly. And then let's look at the patient, what's happening to them. Patient says, I would like care wherever I happen to be. So if I'm traveling, I'm based in Bangalore, the normal course. Today I'm in Hyderabad. Should I need to access healthcare? I should be able to do it here. If I need to access healthcare right now over here, I should be able to do it. Which means, again, that it brings about a shift in the way we look at delivery points for care. It's not just the hospital, it's not just the home, there's a whole other set of points where care might be required and should be provided. At the same time, both the patient and the physician are much more informed. And again, here are snapshots of a lot of information that is available on the web, on press of a button. So there's NHS, and there is something called epatients.net, and there is, I've just picked up a couple of shots from our own health providers like Max and Apollo and so on. So we are seeing a lot of information available and now there is a criticism. I've often been asked the question, you're talking about all of this, but is this not just a very small part of our population? Is it not just our urban population, the educated, the ones that have access to the internet? And the answer is yes. And therefore, I put a picture of the humble little mobile phone in the middle of it all. And that, again, can very well interface with everything else that is available, all the information that is available. And if you're able to devise simple ways of providing information, that can be a very powerful tool too. We know that mHealth has been providing and has been able to improve, for example, maternal mortality in a big way in Africa. So there are examples available. The other piece of technology that has enabled this ability to provide care wherever, whenever, is a remote care solution. I'm not going to talk about it. I think everyone is familiar with it, but I believe it's also being demonstrated at our stall here. So you're welcome to come and take a look at it. But the point is that a remote care solution should allow you to provide care, whether that is in a remote clinic, in some remote village, or at an office, for example, and an ambulance. It could be on, we heard HMRI talk a while ago, but are we able to actually provide care from the point where a person gets onto an ambulance or at the home? So it could be anywhere, a theater, for example. So the point is that any such remote care solution should be capable of providing providing health care wherever a person is. Let's look at in an emergency. We've already heard HMRI, so I'm not going to spend a lot of time on it. Safe to say that what it really calls for is the ability to access, bring together several response systems onto a common platform. It is about being able to intelligently take